Episode 107, Picking a Fee for CashPT and Staff Onboarding. I'm your host, Dr. Justin Schwartzler, and today we're Dr. Aaron LeBauer Perspective. Join 2017 and 2018 Podcast Awards nominated host as we get a behind-the-curtain look at all types of doctors and guest specialties. Let's hear a doctor's perspective. We are in the middle of a cash physical therapy mini-series. Last week, we had Dr. E on talking about his products and also a little bit about location and marketing and, of course, the manual therapy. This week is Dr. Aaron LeBauer, and we're going to talk more about picking a fee, what goes into it. Can you charge too much? And then next week will be Dr. Joe. He is going to discuss a little bit more of the coaching aspect, the logistics, and also a little internal marketing. So the three different people, they all do slightly different things with their cash practice. So I think you're really going to learn a lot, hopefully inspire you, maybe break free from the insurance model. Now, Dr. Aaron, you can check the show notes, open it up in your app or on the website. There's a link for 5 questions you need to ask patients to get them to pay cash for physical therapy. It's LeBauerConsulting.com/5-questions-Justin. But like I said, just go to the site and you can click it. But it'll be a free download to accompany all the stuff that we're talking about today. And what we're going to do is, like I kind of alluded to, is discuss how do you figure out what fee you should charge? What's too much? What's the underlying issue if you're not able to handle that? Training your staff, who should quote, close the deal. We look at the pluses and minuses for mobile physical therapy versus working out of a gym. Should you work in a chiropractic office or a physical therapy office if you're just going to rent space? And then, of course, he has a second doctor that works with him. He also has like a residency program that he deals with. So we're going to talk about onboarding staff, new doctors, and answer those questions like, do you want a carbon copy of yourself? Do you need to be worried that patients are going to not see that person because they're not you? And he also goes through a seminar that he really thinks changed the way he practices and recommends most people would take. So get your OneNote or your Evernote ready. You're definitely going to want to pause this thing and take some notes. I'm excited. I learned a lot the first time and while editing. So I was excited about that. All the show notes can be found at a doctor's perspective /107. Let's go. Hashtag behind the curtain. Live from China in Greensboro, North Carolina. Today on the podcast, we're following up again. We have a cash practice big deal over here today. He's got his own podcast that I listen to it. It's really, really good. If you're into like learning behind the scenes on physical therapy, want to do cash practice yourself, whether you're a chiropractor, physical therapist, or whatever. And he also is a coach with his own consulting firm to help you obviously succeed in this because it's kind of the Wild West and you got to like figure it out. So please welcome to the guest, Dr. Aaron LeBauer.
Hey, Justin, thank you for having me. It's just an honor to be on your show.
Well, I appreciate that. Like I said, I do listen to your show and you got a lot of episodes. And, you know, as a chiropractor, it's kind of funny to hear physical therapists who are like, oh my goodness, we're gonna do all cash and we're gonna get out of the insurance. And I forget, I'm like, that's all we can do. Like, we don't have any other options. We have to be like, a lone wolf out here. So it's really fun for me to hear the other side. And then after that, I'm like, okay, there's so many good things that y'all are doing that we can implement for ourselves. And this is way beyond just a chiropractor podcast here. But that's kind of where I come from when I listen to it. And that makes me excited. So I think there's going to be a lot of people that are going to get some good information from you. So I know at this point, you've been doing this for a long time. You're 100% cash. And if I'm not mistaken, you have several doctors kind of working underneath you now?
Yeah, I've got right now I've got one, and then I'm looking for a second one right now.
Okay.
So
one of the things I'd like to chat about is just the basic story real quick of like why you ended up going into cash versus going into insurances and in the medical referral route and all of that. And then starting the consulting and stuff. And then from there, we'll just kind of blossom and see how this thing goes.
Okay. How much, do you want the 5-minute version? I got the 2-hour version too.
You go with the 5 and yeah.
All right. We'll start there. So let's see. I started out I've had multiple careers, but I started out my trajectory when I became a massage therapist about 20 years ago. And then I got to a point in massage therapy where I wasn't really limited in what I was doing. I was limited in my ability to help patients recover and heal from injuries. Because that's not in massage therapy, it's a kind of a wellness service. You're not truly trained to predict how long is this going to take and what do we need to do next? But I was seeing a lot of people who'd been let down by the system, been to chiropractors, PTs, surgeons, massage, etc., and helping them. But I kind of was coming up to this limit. And so I went back to PT school. I became a physical therapist. And my first clinical rotation, I had a day where I saw 43 patients one day.
Whoa.
And what that looks like in physical therapy is I'm doing manual therapy on one person, talking to someone across the room, trying to guide them on their exercises. And then every 30 minutes, 2 new people walk in the door. And 43 people meant that I was there till 9 o'clock that night. We had a basketball team came in, walked in the door at like 6:45 as I was getting ready to leave, and added another 10 people, and we stayed another 2 hours. And I was just like, that was the day. I was just like sitting there with a pile of notes. I was like, I'm not doing this as a career. This is crazy, because I came from a career of seeing people one-on-one for an hour and making $85 for the visit, doing a massage. And I was like, I'm not going to go to the hospital and earn $38 to $45 an hour, and they're not going to let me treat the way I want to treat. So that's the short version of why I decided that I had to do something else different, do it on my own, and do it without insurance, because insurance dictates how we treat patients. Because especially at the time, there was, I think United Healthcare was like, hey, we'll pay you $42 no matter what you do, no matter how long you treat, it's just $42. And I'm like, and so in order to cover the costs, I have to see a whole bunch of people, and that's not how I wanted to treat patients. And I know that some people get better in that way, but the patients that I was used to seeing that wanted to spend time with, that's not how I wanted it to go. And I didn't want that conflict of interest between deciding what my patient needs and what insurance is going to pay me to do.
And I think you had a guest on the other day. She was saying it was like $1,000 almost a visit in a hospital setting. Of course, they never get paid that. But if your insurance didn't pay it, all of a sudden they could try to stick you with that kind of bill. And you're like, there's nobody on this earth that would pay well, maybe they would, $1,000 per hour for physical therapy.
Right.
That's a bit much.
Right, especially the way they end up doing it, where you get like 15 minutes. So there have multiple instances in multiple hospitals where it's like people are being charged anywhere from $350 to $600 for a 15-minute unit, and that's how you end up with $1,000. And they have whether it's a $2,500 or a $7,000 deductible, you got to pay that first a couple $1,000. And we're charging less than that, and my fees aren't based on that, but it makes financial sense to patients. But that's the wrong conversation to have with a patient, to get them to come into our business.
And that kind of leads me to 2 main topics everyone's going to have. All right, You're not in insurance. You're in a realm of healthcare that usually that's definitely the first question. Medical doctors might only refer to somebody that is in their network. So if you're direct marketing, which is, I assume that's what you're doing, direct marketing to public, and we can talk about that later too. You got to always answer that question. Do you take my insurance? And I charge maybe $200 an hour for the service. How do you handle that? I'm assuming that's something you have to handle. And what's a good way to do that?
Yeah, the best way to do this. So there's 2 things that are happening when someone asks you to take my insurance. Number one, they're used to that being the primary topic of the conversation when they call a medical provider. For instance, if I go see my primary care physician, when I call in or show up at the desk, the first 2 questions they ask me are, what's your date of birth and what's your insurance? They don't ask me what my name is. They don't ask me what's going on. It's just insurance is the primary focus. Mm-hmm. So people call and they go, this is the question I have to ask. When I say, how can I help you? They're like, well, aren't you going to ask about my insurance? So basically, well, do you take my insurance? So that's one problem. That's not something I can help. Maybe we can change, but that's the problem. One of the reasons I think it's the first thing asked. The other thing to do is when someone asks, well, do you take my insurance? Well, first thing we'll do is say, well, ask who's calling, or my name's Dr. LeBauer, or Amber will say, my name's Amber. Ask who's speaking. Okay, and then we sort of redirect. Well, what are you calling about? What's going on? How long has this been a problem? We start asking questions to figure out, well, what is going on? Because at the end of the day, whether we take your insurance or not, it doesn't matter if I can't help you. So why do I need to, really, it's like, does it matter if I take your insurance if you, fractured your arm? No, because you shouldn't be coming here right now. You should be, you should be going to the ER or urgent care and, get an x-ray for a fracture you're bleeding. But the other part of that is when someone asks, we're going to kind of acknowledge it and redirect. It's like any objection. It's acknowledge the objection and redirect. So it's like, Mr. Jones, that's a great question. Before we get to that, is it okay if I ask you a few other questions to find out what's going on and see if we can help you? And we'll just kind of redirect and ask these other questions. And by the time we build enough value, whether we take your insurance or not, it usually isn't an issue for people.
So you train your staff or whoever answers the phone to pretty much have a consultation and over the phone. So that way they already know, like, I sprained my ankle. All right, what's that problem? It hurts to walk. Well, no, I'm training for a 5K and it's in 2 weeks. And now I sprained my ankle. Oh, okay. Now we got to the root of the problem of why you're calling.
Yeah. It's like, why are you calling now versus 6 weeks, versus 6 weeks ago? Well, I've got a 5K to run next weekend. And I'm nervous this thing hasn't gone away. Okay.
Yeah, we can take care of that.
That's the motivation. Yeah. The worst thing that we hear, well, not the worst thing that we hear, but the thing that we hear the most that we can't, it's not that we can't solve it, but it usually goes like, my doctor told me I need the physical therapy. This is like really, like someone said this a few weeks ago, I need the physical therapy. And I have a prescription for 3 days a week. Do I need, do you take my insurance? Well, it's not, the insurance isn't the problem. It's the setup of the call, the fact that this person's calling us because and my wife used this term and it was great. The locus of control is in the referring physician's hand or provider's hand. It's not in the patient's hand. Mm-hmm. So the patient's like, well, you mean you have to evaluate me again? My doctor, and I'll use air quotes, my doctor told me I need, okay, great. Well, we're not the way that we operate, like we're going to evaluate you and this may not be the right place. Those are the hardest people to convert because they're not here for themselves. They're here because someone else told them they need the physical therapy.
And if they've been before, they're just like, well, they put some ice packs on me. Somebody stretched me. They showed me some ball exercise maybe. And that's kind of like, well, that's physical therapy. You're like, well, it's a type of physical therapy, but it's not my type.
Right. You got it. And so having conversations with those it's not those people, I won't say those people who call with this as the reason. It's like, well, why do you need to know all this information from me? Because, so-and-so already told me this is what I need, and they find no value in what we do. They just are looking for the cheapest way to get the commodity or the,
Aaron, quote, Dr. Aaron, I think my main doctor knows I have a rotator cuff issue. He just needs you to do something for it.
Right.
Yeah. So sad. Yeah.
And it's a technical, they're just calling us for the technical skill rather than for our decision-making process.
Right. And I don't know quite the questions yet to ask if you're, it's for a chiropractor. We have our own wheelhouse. Y'all have y'all wheelhouse. Someone like yourself, are you more manually therapy trained? Maybe you do some spinal manips as well. You're looking for like other doctors to refer to. What are some of the questions that we could ask? Obviously, we can't all go to you to find a competent physical therapist who's going to help with real sports injuries or real just injuries in general that they're going to get the best care, you think?
Right. So are you saying like, how could a chiropractor ask a physical therapist the right questions to figure out, is this the right kind of person to help my patients?
Exactly.
Okay. So what we do here in our clinic, we do a lot of soft tissue work. Mm-hmm. We do some spinal manipulation. We do some peripheral joint manipulation. We do corrective exercises. But the main thing is we look at our patients, and in the way that I practice and I train my residents and the other physical therapists come work for me, is we're looking through the whole body to see, is it a joint restriction? Is it a soft tissue restriction? Or is it a motor control problem? And so I'm looking at not just, okay, you've got shoulder pain. Okay, let's just treat your shoulder. It's like, I know I need to look at your thoracic spine, your C-spine, and I also want to see how you squat and your ankles move and your hips move, because it depends on the activity you're having. You got shoulder pain, but if you have it because you're doing an overhead squat, or you have it because you're lifting your kids up off the ground and you can't squat all the way down, and that's how you're lifting them up and compensating. I need to know all those things. So I would look for someone, when I look for, okay, what's another physical therapist I want to look for? I'm looking for someone who's trained in a way that they're looking at the whole body, that they're using a combination of manual therapies, exercise, as well as I want to call it patient empowerment, where I'm not just, PT doesn't happen only when I'm watching you. PT happens when I see you and I teach you what to do at home, and you go home and do it, and it's more than just exercises that someone could do at the gym. It's but they're not exercises that are so complicated that patients can't reproduce them themselves. Does that make sense?
Absolutely.
So it's people come in and they're like, well, I went to PT somewhere else and they just had me doing exercises I could do at the gym, like riding a bike, doing something else. And we're doing things like, I tried the complicated exercises I was taught in PT school, and people can't remember them.
No.
So I've kind of come to a point where it's like, okay, I need one or two things for people to do that they don't have to consciously try to activate a certain muscle, but it's going to give me the result I want. It's going to get them moving in a way that gets them feeling confident in their body.
Sometimes it's like global motions.
Yeah. Or it might even just be like a half kneeling. You're in half kneeling and you're doing a lift from the ground with a band around your knees. And now I don't have to think about stabilizing. The band's getting my body to stabilize without thinking about it.
Very good.
So can I add an input to your body where it gets your body doing the movement I want without you having to think too hard about it? That's what it boils down to for me. And so when I'm looking for other PTs, it's like, okay, how much time are you going to spend with my patient? What are you going to do with them? Are you going to look at their whole body? Are we going to get some hands-on care and some kind of corrective exercise? And even someone who's got, and I don't know how to always find this, but I want to say like a modern outlook on pain. Whereas the pain isn't always the problem of, the tissue injury, but there's a global reason why someone's in pain, or multiple factors, not just blaming it on one thing that we can't fix ourselves. And then, because that's what I see a lot of patients that are having trouble with. They're being told they have a herniated disc. They're like, I was told I had a herniated disc 20 years ago, and I'm still walking around feeling like I've got a herniated disc problem, and no one can help me. And it's just like, okay, like that doesn't have to be your problem for 22 years. They can become the diagnosis, and it's because someone has used words well-meaning that, just kind of like sticks with them. Yeah,
I hate it when they do that. You see them and you're like, well, you're probably going to get, at that point, 20 years, sometimes it's hard to get them better, but less than that, you're like, I probably still get you better. If you want to get better, if your mindset wants to change a little bit, that would help. Do you find that, especially for like chiropractic, if you adjust the neck and you're like, yeah, but, there's something going on like in your hip and it's kind of causing you to always do this and that, and then that's why your neck hurts. Oh, man, you really got to start documenting quite good because, the insurance is like, well, they came in with this problem and now you're adjusting in the low back or a knee or something. Like, come on, man. Mm-hmm. They don't even make sense. Do y'all have that same type of issue with...
I don't.
Yeah. So is that a good reason to go cash then too?
Insurance, I don't. I mean, yes. Here's the thing. Is that some people have the issue, but it's not even about documentation. It's like they can't... It's like, yes, it's not even, I wouldn't call it justifying, but yes, people don't say, look, I did this evaluation, I did this exam, and I can see that this isn't moving well. And the way that they document doesn't allow them to get reimbursed for it, or they think it's a problem, and it's more of a mindset issue. I could justify a lot of things, and I don't have that problem because patients pay us directly, and whether they get reimbursed or not is not up to me. And that's why I do it this way, because I don't want pressure to have to document a certain way or do certain things just to get paid.
Do you still send them a super bill? That way, if they wanted to submit out of network, they could do that?
We do. Absolutely.
Okay. And at that point, they're less stringent on your notes when the patient's trying to get reimbursed.
I mean, the only reason we get asked for notes in the last few years is if someone needs it for a personal injury or a motor vehicle thing.
Oh, you don't take assignment for that either? Okay.
Not at all. And we'll give the notes directly to the patients. The insurance companies, I haven't had an insurance company ask us for notes in 3 or 4 years.
Okay.
When I first got started, they did. And I generally think it's because they just want to prove that we actually saw the patient and we're not just a pop-up scam.
That's fair on their end, if they're still paying somebody. Right. When you're looking at rates, I don't know any cash practice that's doing $55 an hour, $60 an hour. Is there a formula or a way to tell you like, well, I'm in Denver. Well, you're in Greensboro. Well, I'm in a small town 30 minutes from Greensboro. So, maybe 10,000 people. Is there some way to figure out the rate that they could pay? They people, you need people, but sometimes it's like you can overprice it to where you can't get people in sometimes.
Right. You can, well, I would say you're not over, I would say, yes, there is a formula that you can use for general guidelines, and you can't overprice it.
Okay.
You can undervalue it.
Ooh.
Okay. So if someone thinks it's too expensive, they don't understand the value of what you can do, and we've done a bad job of explaining it. And so you have to look at, okay, what's the maximum number of patients I could physically treat every week without feeling burnt out? So for me, it's about 25 people for 45 minutes. Like, I don't want to see, when I'm seeing 26, 28 people a week with the type of work that I'm doing and the amount of energy it takes physically and emotionally, et cetera, it's like 26 is just like one too many. So I got to look at, okay, how much am I charging, and what are my expenses, and can I have a comfortable life doing that? Hey, but that's not enough. That's like the bottom. That's the bottom number, like absolute minimum. Like, you can't go out and charge.
That might be what you start with.
I wouldn't even start there. I would look at that and go.
Sometimes you got to gain that confidence. Like, people will pay you. You are worth it.
Yes, you are. And you can generate $100,000 on 9 patients a week. So you only need to see 9 treatments a week to earn 6 figures or gross 6 figures. But here's the thing. This is why I say it's about the value. It's okay. So I was just working with one of my coaching clients yesterday. We had a all day VIP day, work on her business, and the thing she starts out with is, okay, here's the patient I treated. It's like she's just like, oh, this is why I'm doing it. I just saw a patient yesterday. It's a little 12-year-old girl who's told by the surgeon that they're gonna have to break both her hips in order to fix her hip pain.
Oh.
And I'm like, if a 12-year-old girl is being told, we're going to have to break your hips, so one, it's like the language is, come on.
Yeah.
Don't use that language with little kids. Say, look, we're going to use some medical term that sounds less scary, or, sometimes medical terms sound more scary. But look, we're going to have to go in and we'll do.
Or rearrange it or something.
So do something, right? So she's scared. And then this woman who I'm working with, the PT, looked at her, within 30 minutes, she got her, dancing the way that she needed to dance without pain, because it was a stability problem that she found. Right. And this little kid's in tears. And so what'd she do? So here's the thing: my point is that what was this surgery going to cost this 12-year-old girl and family? Easily $5,000, but probably more like 10 to 15, plus 8 to 12 months of rehab.
Yeah.
Right.
Yep.
So, all right. So we're saving people's lives. We're helping them get back to doing the things that are most important to them, like dancing and picking up their kids and going out to the movies and driving to work, or running a 5K. We're saving them from months and months and years of agony and thousands of dollars in bills. So what if I charge you $3,000 for that one visit? I just saved you 10 in 10 months. Like, that's absolutely worth it. So what we charge for therapy, it's almost like we got to stop looking at okay, I'm going to charge this per hour, and let me charge you for the result. Like, what's the result that you want? And okay, that program's going to be just $2,000. I'll see you once a week for 8 weeks. Of course, 8 weeks, and I'm going to give you these things, and I'm going to help you get back to dancing or running or doing the thing that you told me you want with that, while avoiding feeling like you need to get surgery or take more medications. Sound good? Yes, great. That's exactly what I want.
See, and I've thought about that. We see the same stuff over and over again. And, I can look like an x-ray or, what's your symptoms? Okay, you got headaches. And I've thought about that. I was like, can I just say, hey, you got a headache? I charge $750 for that. What do you mean? It's $750. I can't guarantee you that you're going to get better, because that's not right. But I've got a really high success rate. So let's say it's $750. How many visits is that going to take? I'm not sure. Maybe 5, maybe 12. Just depends on how you respond. But we'll start out at twice a week for 2 weeks, maybe 3 weeks, and just going to see where you're at. And I was like, I wonder, can you do that? Or do you have to just charge like a monthly rate, or like a per? Like, part of me is kind of like, if I got to charge this per hour, but I'm done with you in 30 minutes, man, I got to figure out something to do for the next 30 minutes. Otherwise, I guess I can just refund you half the money or something. I'm not sure. What do you think?
Right. And so where that gets like, I think that's great. I know some people do that. Where that gets complicated is giving people a super bill or filing an insurance claim, because those are based on time. Mm-hmm. So the way we get around that is I'm thinking in my head, okay, it's going to take me about 8 visits to fix, or to help them fix the problem. And, look, if they're better in 6, I can do some things for 2 more visits. I'll just space them out a month and get them more on a performance track, or, and I'd even tell people, like, look, your pain may go away before we're finished. And that's exactly where I want you. So I'm looking at it when I quote someone a price. I'm thinking, okay, I've calculated how much I want per hour or per visit. Here's what that cost is going to be for about the number of visits that I'm going to see you. And so I'll say, hey, look, this is what I recommend. It's going to be just, $750, $14.95, $19.98, $24.97, and we're going to do all these things. How does that sound? Great. Okay, we're going to get you started once a week for 8 weeks, or once a week for 6 weeks, and then we'll probably do every other week for the next 4 visits. And I'll get Amber, my assistant, to get you all scheduled and take care of payments. Let me show you some of the exercises that we're going to do, and I'm going to recommend that you do between now and our next visit. And so I've still tied it to numbers of visits and some units. But as insurance is reimbursing, deductibles are getting less, co-pays are getting more. It almost doesn't really matter. We're going to get to the point where it doesn't matter. You'll be like, yeah, I'll treat you. The problem you get into is where it's like creating a boundary for how long am I going to treat you for that $750 or $1,000 before I say, look, this is going to, I need to sell you, another package, or it doesn't work. That's where just figuring that piece out is the gray area.
Yeah.
You know what I mean?
Yeah, that is tough, because you said $750 and now I got to come and give you more money, or do I just come in for a few extra times and I don't get paid for it?
But, there is an incentive to get, one incentive, there's an incentive in there, say, oh, $750, okay, I'm going to discharge you early, because that's, there's some ethical issues around all of these. And I think it's like, okay, I know that some practitioners say, look, I know plantar fasciitis, it takes me 5 visits. Boom. Great. I'm glad you know that. Like, I have a hard time with that, because in my position or my practice, my experience, people come in with a back pain issue and visit 2 or 3. They're like, oh, I didn't tell you about my chronic migraines. Or I didn't tell you about, the hip issue I also have. It's keeping me from sitting down. I'm like, oh, okay, great. We've uncovered some more things. This is going to take a little bit longer sometimes. Yeah. So, but I do think that at the end of the day, if we can charge someone, $1,000 or $2,000 or $5,000 to get rid of their back pain, and they avoid getting surgery and the possibility of dying in surgery or getting a hospital-borne infection, or, even just having no change, then I think that's a big win.
I think the audience is going to have some things to ponder with some of these numbers now, because like you said, there's like the ethical, the gray area a little bit. Let's see. Do you get any backlash from colleagues because I know there's chiropractors out there that I think this is the problem. They were charging, whether you came in for a low back pain, sciatica, neck pain, it didn't matter what it was. It was always, oh, you need 36 visits and it's going to be $5,000, or whatever. And everybody had the same thing. But for yourself, you evaluate somebody. Can someone have a different, like, oh, they have an ACL repaired and you need to take care of it? Well, not every ACL pair is going to be the same. So if Bob got this for $1,500, but then Sally came next week and they're buddies and you didn't know that, and you charge her $2,500, do they ever get like upset? Like, hey man, what? I thought you said an ACL takes this much and I'm getting charged more or whatever. Do you ever have that happen?
We don't really have that happen with patients. It's because what we're doing is we're creating unique plans for people. Someone ever said that's like, that's what. We're not looking at it like, okay, I've got an ACL, I've got a shoulder thing, I've got a hip problem. It's like, I've got a person in front of me, and this is what I think it's going to be. And, and so I'm not basing it on, okay, this is the protocol for this is what this is going to cost. And so I don't really have that from patients about what we're charging. I've had people come back and say, oh, you're charging more now.
Okay.
Yeah, we are. when we've raised our rates over the years, because there was a time when I wasn't charging enough to allow me to employ other people.
Yeah.
I wasn't charging enough, because I didn't have a coach that helped me set my rates when I started.
Right.
In the right way, because there weren't a lot of people talking about cash-based physical therapy 10 years ago.
Okay. Yeah, I just was kind of curious because I know, patients talk, and if your headache was this much and my headache was that much, why is mine less or why is yours more? And I didn't know if that was going to be like an issue, but okay.
Yeah, no, it's not really an issue.
That's good to hear. That's really good to hear. Like you said, you want it to be custom, and that's one way to customize it. All right. I've listened to several different podcasts with different guests that are doing it, and everybody seems to be successful regardless of what they pick. But what does Dr. Aaron think? Mobile, driving to people's houses, renting your own space, working out of a gym. You have a magic bullet? Do you got any pluses or minuses on these scenarios? What do you kind of recommend?
I think they are all great. They're all great options. It kind of depends on your target market. Do you want to work with busy professionals or busy moms, and it's a convenience to them for you to go there, go to their home or go to their office. Mobile's great. Mobile's also a great way to get started because it's lower overhead. You don't need to rent a space. You don't need to buy a bunch of equipment and things that, like chairs and all that stuff. It's great. I think working in a gym, if your target audience are gym members and a gym has an open space, I think it's an amazing place to be. The two kind of caveats to that are, like with travel, it's one, you're going into other people's homes. So some people are uncomfortable as therapists going into other people's homes, and you have to drive a lot. And so your time isn't as efficient.
Yeah.
Right. So you can't see as many patients. So some people say, oh, I'm traveling to your home, let me charge you less.
What?
Well, really, you're traveling to someone's home and you should charge a premium because it's a service to them. And it takes you 2 hours to see one patient for an hour, and so you're losing income. With a gym, a lot of people get into it and they think, oh, they're going to get a lot of patients from the gym.
Man.
And my thing is that you're going to get in there and you might get a lot of patients from the gym, especially if it's a CrossFit. But I know people where they come into the gym and the trainers, the owners, they don't really believe in the therapy, and people are disappointed that, oh, no one came to see me. Those are the kind of the things like that, the expectations of getting into it. And a brick and mortar clinic like we have, you've got an overhead. And the problem is people think, oh, I have to be in an expensive part of town, a nice part of town. And you don't have to. You just have to have a nice, safe space for people to come. I think they're all great models. And even there's, online models, there's telehealth models, combination models. I think they're all great.
Have you found that, especially if you're starting out, you could just rent a room from another physical therapist or from some other type of health facility to keep your overhead down because you may only need that one room to start with for like a while?
Yeah, I think it's interesting. I think that as a physical therapist, you'll have the most success renting a spare room from a chiropractor, a massage therapist, an acupuncturist, or in a gym versus another PT clinic. Because then but I know people who've done it through a PT clinic, and vice versa. I don't know how that would be. Chiropractor renting a space with another chiropractor who's charging cash when one's insurance. Like that's where it gets.
Yeah, that'd be tough.
It's like, well, why am I paying this or that? It's like, it's really, you're just renting space. You're not expecting patients to come from the same person.
Yeah.
You know what I mean? It's like, and even with, I've worked with people who the PT is cash based, the chiropractor is not. And patients are like, well, why would I go over there if it's just little barriers. But I know PTs and chiropractors who are both out of, cash or both insurance, and they have a hard time getting patients to go back and forth. So, it's two different copays too. If it's set up like two different entities, and even if it's not, I'm not 100%, but chiropractic has its own codes versus the PT. So if someone's like, I hate chiropractic, but they like the idea of being adjusted maybe by a PT for some reason, then it's like you can find that person, and it's all probably within the one copay, or you know what I mean? It's all in one house. And the same thing if they're like, well, I like the chiropractic thing, and he started doing some physical therapy, or he does a lot of the same type of stuff, and now I can just do it all under one roof, and I don't have to do two copays or drive around town to two different people. But
I think you just have to know your limits.
Yeah, I don't know. Yeah, I don't know if like there's a chiropractor. I know a lot of practices have chiropractic and PT where they're, like husband's a PT, wife's a chiro, or they're just two different professions in the same business. If they're in network, if it's just one copay to see anyone between the two professions. I know we have different evaluation codes. A lot of the treatment codes are similar. So I think, and I know that's tough for people. And they're like, oh, well, there's two copays. Oh, it's $50 or an extra $50. I can't possibly do that. Like, why would I do that? And at the same time, I got people coming in paying us $250, more than twice as much for one visit. It's the same conversation, getting people to justify their copay versus the in-network or the cash practice price. And I can tell you, for 2019, my health insurance, a specialist copay is going from $75 to $150. Whoa. So it's doubling. So that's for PT, chiropractors, cardiologists, anything other than primary care. It's going to $150. So my copay next year to go see myself is going to be $150.
And you're going to have to pay somebody back because they don't reimburse that much. That's what's crazy.
Right. So, it's like it's kind of crazy. I mean, it's just, so I think we're going to get to the point where it doesn't really matter. And I think that day is coming pretty soon.
Let's switch gears a little bit. I probably could, obviously you have clients that could talk to you for hours on an entire weekend about all the nitty gritty. So, but you have this consulting firm. You do this, for a living as well. What do you, like I said, you hired a second doc. Apparently that's a pretty big deal from what I'm hearing, because they got the lag time. You got to train them. They're not making as much money. Are they going to be as good as I am? Do you hire a new doc out of school or someone who has like experience? Do you have any tips on that for us?
Yes. So it depends on how you want your practice to run. I want patients to come in and get a similar experience, whether they see me or they see Dr. Shelton or Dr. Nielsen, Dr. Nielsen was my first resident. I have a residency program as well where I do a clinical and business mentorship.
Oh, nice.
And he was here for a year. And I want people to get the same experience. So I want us all to have similar training. I want to be able to train them. And so getting someone out of school or within the first few years, I think is what I prefer, rather than someone who's been out 7, 10, 12 or more years and they know this is how I practice. I feel like that would be harder to find someone to match my style, because I want people to come in and, it's not just about me. It's not just about seeing Dr. LeBauer. It's not just about, it's like, I'm going to go to LeBauer Physical Therapy and this is the experience I'm going to get. So that's kind of what I'm looking for. I can tell you it's hard to find people who, people are like, oh, well, I'm not ready for a cash practice yet. I'm like, you don't have to be. I'm going to train you. I think the scary thing is the first time you do it, it's like, are people going to not want to see so-and-so, see the other person? And I've had plenty of patients go see one of these other two guys and prefer to stay with them.
How dare you?
Great, because, I know, how dare you. But that's what I want. Like, I want to have my time. I've been treating patients for almost 20 years. And it'll be 20 years in, I guess maybe it's it's 19 years this month. So I graduated from massage school in 99. I've been doing that, and I'm ready to multiply myself, and I have to have people come in and treat my patients, and that's the scary part, is making sure that people don't notice too much of a difference. But these guys are really good, and they're right out of school, and they're commanding high prices.
You can force them to take certain seminars too.
Yeah, I'm forcing them. I'm like, hey, what they both said to me, what do you recommend that I do and go learn? And I said, these are the things that have helped me the most. These are seminars I like, and they both went and did 2 Con Ed courses on their own dime based on my recommendation before I hired them.
That's commitment.
Yeah.
Yeah.
And they're go-getters. Yeah. They're like, all right, I'll do it.
What's one course that you recommend?
I think the 2 things that I recommend are something soft tissue based. Okay. And I like using my hands. And from when I became a massage therapist, not only did I have all the massage training, I did some training with John Barnes doing myofascial release, and I thought that was great, and I love the techniques. But the one course that I recommend, so I think you can get soft tissue techniques in a lot of different ways. But the one course that I think that I recommend for most practitioners would be the Selective Functional Movement Assessment.
yeah.
It's Gray Cook and Greg Rose and a couple other guys. It's great because that is the thing that put together all the special tests that I learned in PT school and all the things that I was doing and put it into like a very kind of logical order that I could repeat regularly to figure, no, okay, this is where I'm going to do some soft tissue. This is where I need some corrective exercise. This is where I need some patient education. And it's like, it just put all those things together. And I was like, oh,
It gave you a system.
aha. Yes, it did. It gave me a system that wasn't rigid and it's not a protocol. It just put together the way of looking at the body. Then I was like, oh yes, this is why some of those people weren't getting better. And this is why I need to continue doing, these things with these people. And I was just like, oh. So, and it drastically improved my effectiveness. But I already had the soft tissue skills, and my manipulation skills aren't, chiropractic level because we didn't do it that much. One of my good friends here, I know that's right. One of my good friends here, Chris Anthony, rented space for me for a year and a half, and he was amazing because he did that all the time. But at the same time, it's just a difference. But we do manipulation, and I do it for maybe 30, 40 seconds, but I do a whole bunch of other soft tissue and other things around it. It's not one thing that I'm doing. I'm putting together like a combination of things, and it's something that's really, really vital. And with all that being said, being able to see how all these things fit together, that one course kind of really helped me put a lot of those things together. So, I had the soft tissue stuff, and I went to this course. I was like, whoa, there we go. I was competent in manipulation. I'm pretty much an expert in soft tissue, and it just put together a lot of stuff, and it allowed me to go figure out, okay, now how do I become an expert at corrective exercise? And it showed me the things that I was missing from
That's awesome. Sometimes some brains are just set up for that. I've noticed there's some chiropractic people that are having their own systems like that, and when you watch it, you're like, oh. You just sort of, if you go through A through E, you just might always skip C because you just didn't know to look for it or weren't sure how to incorporate it. And then once you figured it out, oh, now I can do that more. And these other people are getting better, seeing better results. You're like, thank goodness I took a course in that.
Right. Yeah. And I was also at the course, and Greg Rose, he's a chiropractor and, works at TPI. And he was like, what's up with your ankle? I was like, what do you mean what's up with my ankle? We were just going through a demonstration, and he was like, oh, come here. And it was eye-opening because he was able to see this, that my ankle was never a problem. I had an issue with my knee, and when I first went to a CrossFit class, the very first time, coach gave me too much weight to do, some kind of Olympic lift. And I was like, oh, my knee's not feeling good. And I was like, my form looked good in this. CrossFit coach, of course, like, yeah, the form looks great. Well, I realized I didn't do CrossFit anymore after that because my knee hurt for like a month. Yeah. And it was just like irritated, and I was like, this is never a problem. So I didn't go back and do it. And like 2.5 years later, I'm at this course, and Greg's like, what's up with your ankle? And I'm like, what do you mean? And he's like, he did a manipulation. He's like, do this. He's like, oh, you're lacking dorsiflexion. And I was like, oh, that's what was up with my knee, doing like this, clean and jerk or whatever it was thing. And I was like, oh, that was it. It's just a whole body system. And it takes other people sometimes to go, there you go. There's your problem. It's somewhere else.
Yeah. Yes. And you're a big bicycle guy, right?
Yeah. I used to race bicycles nationally in the United States. I spent a summer over in Belgium, racing in Belgium, France, and the Netherlands. Done that a long time.
That's cool. Have you created your own like onboarding system when you start hiring these doctors, like through videos or manuals and things, so that you don't really have to be there next time you hire someone else?
Mm-hmm. Yeah, we've got. See, I have it. I actually haven't turned it in. My plan is to turn it into like a little course.
Of course you will.
So it's like an online course.
$19.95.
I actually haven't. I've got that built. I know. I've got that built. Well, it's not even a course to sell. It's a course for the next guy or gal to take when they get hired. It's like, hey, here, go register for, go here and do the training. And then when you come in person, you'll have already.
You're saving the doctor lots of time if they can do it and not have to actually do it themselves and recreate the wheel. So I'm giving you a hard time, but that's why people pay for it.
I know. And I've got it on a spreadsheet right now. It's just like, I just need to go plug it in. But yes, that's the whole thing, is systemize the whole thing. I think my coach calls it, they create the alien abduction manual. I'm like, yes, because it's not like, hey, if I fire you or if I replace you, it's like, hey, if the aliens come and pluck you out of the sky or pluck you off the earth, like, I need to know how to do your job. Like, we need to have that systemized, and those systems are really what allow businesses to run.
Hey, real quick, I heard one of your podcast episodes. I don't remember her name, but she was like your front desk type person, and probably many other roles. But who, quote, closes the deal? Or do you have to take on that responsibility of, like, it's going to cost $2,500, or do you pass that on to somebody else?
Front desk. Okay. So here's how it works. We, in a treatment room, we'll pitch the deal. We'll get confirmation, like a verbal confirmation, yes, or if there's an objection, we'll meet the objection. And then, but it's Amber's job when people get up front to close it, to take the payment, to offer the different payment options that we have, and to get them to commit that day. So my big goal is I would rather people commit to the plan of care than pay one at a time. So we've got a couple different options where we'll give people a 5% discount for paying ahead, or we could get them on, let's say, even if we got them on a payment plan, like a no interest payment plan, then at least they're committing to their 8 visits versus, one at a time. But she's the one that offers those different options to people and gets them to toss over their credit card and gets that. So she's kind of the closer, but we pitch it, but it's not like going to buy a car,
right?
Like we go back and forth and, let me talk to my manager and make sure that price is right. It's just like, here are the options. Here's the price. Here's what we're going to do for you for all that. And this is what you're going to avoid. And when you go up front, Amber will take care of the payment and get you on the schedule. And Amber gets them on the schedule, gives them the payment options, and closes the deal. Are you
finding that's what, I guess that might be what you teach, but are you finding that's a common thing with the cash practices, or a lot of people kind of do pay as you go?
I think most people either do pay as you go or they discount too much. And it's, they discount too heavily because they're
pay now 40% off.
Not confident. Yeah. Or, hey, I had someone the other day and it was like, okay, they're charging $160 or $175 for a visit, but, for an eval, $125, $135 for follow-ups, but all the packages are, basically done, and it's like $110 per visit once you sell them a 10-visit package. I'm like, why is the package making your rate so much lower? It's getting lower and lower. People will discount. They go, what kind of discount can I give to get people in the door? Well, it's like the discount's not going to get the right people in the door. The discount, to me, shouldn't be about discounting the therapy. It should be getting commitment. Like, hey, you commit to 10 visits, I'll give you a discount because I know now you've committed. You put your money where your mouth is, and you're ready to go, and you're going to be a great patient. And that's really what it's for. But people are either discounting too much, or they're doing it because they're discounting too low because they're not confident that people will pay.
Okay, it's very similar. And I think I might have asked this already, and I'll just see what you say. Do you get a lot of pushback either on these techniques that you're teaching, like, oh, you're scamming the clients, or I can't believe you're making people do that, that's like unethical? Because depending on how you do it, it can be. But what are you finding?
Yeah. I'm not really I don't know if people are saying anything about the sales strategies. And I know that people, when I teach it, they don't believe that they can do it because they don't value themselves, and they wouldn't go pay $200 for PT themselves. So how are they, there's no way they're going to sell it. The pushback I get is just in the general cash-based thing, I've had plenty of people say, oh, cash-based PT is not ethical, or it's not the way, not everyone can afford it. And, it's okay to have that opinion, but if you actually looked at things the way that I do and the way we talked about at the beginning, it's like, everyone can afford it. Who cannot afford to come in and get quality care? Like, you can get quality care in network. You can get one-on-one practice in network. And people in network are failing to collect $25 to $50 copays because the patients don't value it. We have to be able to sell the value of what we provide and do it in a way that's ethical. And the way that it's ethical to sell is that if you absolutely believe that this is the right thing for that person, which is what I do. I know that I have the potential to save people from life-altering surgery. So it's my ethical obligation to sell them, into coming to see me in my practice, because I know that that's what I do.
And some people just hate the word sales, but it's just whatever you want to say.
Right.
It's just, it has to be done.
Yeah. Well, sales is one of those things where people do all the time. They don't realize it. They sell people into going on a date with them. They sell people into going into the restaurant that they want. They sell people into not going to a certain movie or eating a certain food or, doing, any activities. We're selling all day long. If we are afraid to sell our own services, we're not going to impact the world the way that we want.
Even if you're taking insurance, you need to come 10 visits. Well, if you don't do your job, they're going to quit if the pain stops at 5, or they're like, hey, it's been 5 visits. I don't feel like I'm better. I'm not coming another 5 times. Like, I'm just done. It's still sales.
Right. It's sales. And a big part of that and solving those kinds of problems are pre-framing people. Like, this is what you're going to need. This is what you're going to expect. This is what you're going to experience. And, so people forget to do that, or they don't know that they need to do that. Like, why are people dropping off? I don't know. Like, maybe I need more new patients. And this is the most common thing. People come to me with, Aaron, I need more patients. Can you help me get more patients? I'm like, well, you're seeing 35 people a week. You don't need more patients. You just need to keep them from dropping off after 5 visits. If you've recommended 8, you need to raise your rates. You need to, fix your onboarding process so people, love you and refer more patients to you, and you don't have to get more patients. You can take care of the people that you have. So people don't want to hear that they have to do some hard work.
Exactly. Hey, switch gears a little bit. I want to respect the time that we have left with each other. I like to ask about a little personal stuff. Do you have a home life balance? If not, what can you do better?
Well, do I have a home life balance? I do, but I don't consider it it's not balanced the way people think it needs to be balanced. Because as an entrepreneur, the balance looks a lot different than if you have a job. Okay, I don't get home at 5 and can turn off my brain about the business. So I get home at 6:30. I hang out with my kids, and once everyone goes to sleep, I might be back doing some work. Or I can get off at 3 o'clock on Friday, pick up the kids, hang out with them all afternoon, and maybe Friday night or Saturday afternoon, something will come up and I'll do a little social media, something. I'm doing some work. I'm always thinking about work. So it's not really I wouldn't call it a balance like 50-50 to expect 50-50, but I can set up my business and I can work hard for a while and set my business in ways that it gives me time away from the business. But it's really hard to get completely out of the business because it's my passion and it's why I do what I do. I love the work that I do. So balance looks a lot different than what most people say or think of and think, oh, work-life balance. Like, this just didn't, it doesn't exist in that way.
I completely agree with you because there's, like you said, I can't turn it off, and I'm not neglecting my kids. I'm not neglecting my wife. They're getting their time. And then when it's my time again, I'm excited and I'm like, oh, let me go twinkle with this and fix this or do this. And you're still excited about it. That's what I still consider a balance. It's as long as, in your third marriage and kids hate you because you don't spend any time with them, like, that's a problem. There's not a balance there.
Right. And it's even so much to say the first couple of years, it's going to be work. It's going to be like, look, I am going to be busy. I'm going to be, grinding it out, but I'm going to get this to the point where it allows me to have some free time without losing income. And that's one thing I think people fail to do is systemize their business in a way that they can go on vacation with their family and not worry about losing income while you're out of town because you're not treating patients.
Now, it does take time, I'm assuming, to be able to get to that point, like with second doctors or figuring out how to get there.
And it does, but it doesn't have to take long. Most people think it's got to take a long time, and it really doesn't. You can set up your practice from the beginning to do that if you have that as your vision. A lot of people are just trying to get out of their job and they build a job for themselves rather than building an asset.
Okay. Any books, podcasts, or apps that you think we should check out?
Yes. I think the book that's had the biggest impact on me and my career is .com Secrets by Russell Brunson.
Mm-hmm. Yeah.
With ClickFunnels. It's awesome. It's one thing that I do is I've got a back pain ebook that, I have on my website, and I give out I share that with people. It's a ClickFunnels funnel, and it's because there's a lot of other reasons to do that, but the way it's almost like reading that book, because Russell Brunson takes a lot of these theories and ideas and action steps and puts it in that book that can impact a clinic right away. And it's a book I go back to and I've written in the notes. And it's one of the few books that I've done. He's also got another book, Expert Secrets, which came out afterwards. And there's 2 books I write in the notes and the margins, and I go back and look at it and I get something new. There are very few other business books that I've gone back to more than the initial reading. And so, yeah, that would be it. And so then, because he's added so much value to my life just through his book, I'm like, I'm going to use ClickFunnels because, one, it's good, but, I'm like, well, he gave me value. I'm just going to use his product. And it's great and better than a lot of other alternatives. But there are other options. But, it's the one that I like. And I feel like, if I started again today, I'd be all in with that for sure.
I heard he's in the process of writing a 3rd book.
Oh, wow.
Yeah. I actually went through both his books and I was, trying to sell my own book and all this. And I was like, okay, I went through and I got like a document. I don't know how long it is, but it's quite a long time. Mm-hmm. And that way I can just print it 3 or 4 times. Like, okay, here's the acupuncture book. Here's the chiropractic clinic. Here's the podcast thing. And you can just go through the story and the, all the little parts of his book.
Right.
And that way I don't have to reread the book. I just have like a 6-page handout of, okay, Justin, go through it. Here we go. Awesome. Yeah, I love it. It took time to do it, but I was like, oh, this is going to be so worth it later on in life, hopefully.
Yeah, absolutely.
Cross my fingers. Awesome. Well, how can people get in touch with you?
If you want to get in touch with me, the easiest way to do that is go to aaronlebauer.com. That's my website, and I'll have links to all my social media. That'd probably be the easiest one place to go. I'm on Instagram, Facebook, and on the internet. So that's it. You can contact me from there, see some of my blog, podcast episodes, downloads, all those things.
Dr. Aaron, you brought it. I assumed you would. And I just think that people are going to have to pause this a bunch of times, write some notes, and re-listen to it because you definitely gave a lot of good information today, and I really appreciate that.
Awesome, Justin. Thank you very much. You asked some great questions. So it's a pleasure being here and very easy to share the information with you and your audience.
Well, that wraps up another episode. I want to remind everybody that we have some great affiliate links available. If you're into instrument-assisted soft tissue manipulation, we've got the Edge tool and we got the Hawk grips. Saves you about 10%. Also with the Edge, you've got the blood pressure cuff restriction system. You've got the G Suite inexpensive EMR in case you're doing cash practice. If you want to know what hosting I use for podcasting, it's Blueberry. Pure VPN, that's one of those ones I use to help keep my payments secure as well as access the internet more safely. You've got the Primal Paleo grass-fed protein, bone broth style. Save 10% on that. No sugar, allergy-free, gluten-free, dairy-free, all those types of things. Mentor box, get taught by the author. We got Set for Set for those floss bands that you may have heard about on one of the episodes. I really like those. Any Amazon products that you might want, click the link in the show notes pages. And of course, I got my own electric acupuncture pin to go with the no needle acupuncture book. From time to time, I'll have a bundle set where you can get them all together for a great price. I also have the free downloads at doctorsperspective.net/blueprints. And what lately I've been doing is substituting a 5th one. Like I've done a knee, and depending on the guest, I might do a different type. So check back there. So all those resources can be found at doctorsperspective.net/resources. There's also t-shirts at .net/t-shirts. Put up some new designs from time to time, like making lemons out of lemonade, shrimp po' boy, plus all the chiropractic and podcast swag that you could want. If you have any ideas for guests, please send me an email, justin@doctorsperspective.net. I'd love to hear who you think would be good or a profession that you may not have heard yet. If you can, send me a review. That's .net/subscribe, Apple, Google, Stitcher, Android devices. You just click that button. It'll take you exactly to the page you need to. You can write a review, hopefully a 5-star review. Like I said, it does help for other people to discover what we're doing here. And we've got over 100 episodes. This is going to be like our 3rd year. Super excited. We're going to have a little mini-series like we've been doing, which has been fun. Hope you've enjoyed them as well. That's the feedback I've gotten. And one thing I haven't really talked about too much is the doctorsperspective.net/support page. If you want to host a cup of coffee, go for it. If you want to pledge a little higher fee, there's buttons for that. There's even monthly recurring for those who feel like, wow, this is like the cheapest mentor coach program I've ever seen because you interview so many different kinds of doctors and I've been able to implement things that I've heard and it works. So monthly recurring payments, which also can get you my books for free, t-shirts for free, the first book, that deals with health and exercise, getting on a diet, getting your financial health in order as well, things I've learned in China. That book is available as well. And one thing that I don't have like a full-blown page about coaching and things, but there's a little button there. I've had people request, hey, doctors and non-doctors asking me, can I do more than just answer a couple of questions? Or could you be my coach for a little while? And I say, yeah, we can do that. So it's something I haven't really advertised, but it's something that I can do, whether it's marketing, some strategies for new patients, growth, those types of topics. If you're interested, just email me, justin@adoctorsperspective.net. As always, listen, critically think, and implement. Have a great week. We just went #behind the curtain. I hope you will listen and integrate what some of these guests have said. By all means, please share across your social media, write a review, and if you go to the show notes page, you can find all the references for today's guest. You've been listening to Dr. Justin Trosclair, giving you a doctor's perspective.